Good afternoon, everyone. My
Good
name is
morning.
my name is Marie Kinsella, and we're here to have a discussion about postpartum doulas. We're going to talk about what they are, what they do, and how you can access them. So I will now introduce Vanessa. Can you introduce yourself?
Hi, good morning, everyone. My name is Vanessa Velez. I am one of the postpartum doulas out of 4 at the Partnership for Maternal and Child Health.
Thank you for that. And my name is Marie Kinsella. I'm the Director of Community Programs at the Partnership for Maternal and Child Health of Northern New Jersey. So I imagine people are saying, well, what is a postpartum doula? What do they do? What is the purpose? And why is there a need? So Vanessa, what I'd like to talk to you about, so explain, what is a postpartum doula?
So postpartum doula is like a professional worker who works with mom after she gives birth. So we work with her in the postpartum period that, is the first 6 weeks after birth, but it could continue until a year after birth. And our role during that time is to help mom, discuss maternal nutrition, lactation support, family planning, focus on mental, emotional, medical, and physical health. We talk about self-care. We help with exercise. We help link them to referrals. We also help link them to um, community health workers. We support mom in all her needs, and we also do home visits with mom.
So thank you for that. That was a very comprehensive overview of, what you do. But I'd like to talk about, what does a visit look like? A mom, just coming home with that new baby. What would that visit look like for her?
So when we visit mom, we assess what mom's needs are because some moms are different. Maybe they have a partner there to support them, and maybe they don't have any support at all. So every mom is different and their needs are different. But that first visit when we visit mom is to assess like what their needs are, how we can help them. And then we also, do a little screening for them, like a health screening, ask them questions about their previous, births, previous pregnancies, just to get a little information about mom and know who we're working with. It's more like a meet and greet, so they get to know us, feel comfortable with us, and then we get to meet them as well. And from there on, we can assess how we move forward.
Wow, that sounds wonderful. I know that you are a mom, sort of a new mom, your little one. So what was your postpartum, the first few weeks at home with that new baby? What were they like? And what did you feel, if anything, you could have used to support you better during that time?
Yeah, so I have a 2-year-old named Xavier, and at this time, my family lives out of state, and I was a single mom. So it was very hard navigating, life caring for a newborn and not feeling that support. Everyone's there while you're pregnant, but then it's like, where did everyone go after you give birth? Because they think you're healthy, baby's healthy, and you don't feel like you have that support. So I had a doula during birth because there are full spectrum doulas that are there during birth, but I wish I had a doula postpartum to help me during that period after birth because I did go through a little bit of postpartum depression, a little isolation. That transition after giving birth was a little tough for me because I didn't feel like I had enough support or guidance. I'm a new mom trying to figure it out and trying to learn how to care for this baby, but also take care of me because the baby was number one. So there was things I didn't do, like eat properly, or didn't care if I ate, or, it was all about baby and putting my alarm every 2 hours, making sure he's eating and forgetting about like myself. So I wish I had a postpartum doula. And now that I am a postpartum doula and I see the work that we do, I think it's essential for moms to have a postpartum doula and help support them, even if they have a partner or not. That's just an additional person to help them and support them in all their needs.
Yeah, thank you for that. Because as you said, even if they have a partner, I am a mom of five. And I remember bringing that baby home, husband's at work. And it was a lot, particularly if you have more than one child. and it's like, how do I care for all of them? How do I and, and then having no one really to talk to, no adult, it was just like me and the babies. And, when I hear about this work and this support, it just seems like something that certainly would have benefited me. I remember back then, you felt a little down and your mom said, that's the baby blues, you'll get over it. And as we know, that doesn't happen for some women. You just don't get over it because it goes past the baby blues. So can you talk a little bit about, postpartum depression and, what do you do as a postpartum doula to assess if a person needs additional support in that area?
Yeah, so one other screening that we do other than the health screening, we do a Edinburgh screening where we want mom to be honest with herself and to screen for, how she's feeling. We tell mom, tell us as honest as you are. You're not gonna get in trouble by anybody. It's not like DIFITs or someone's gonna come at your door saying, "Oh, you're depressed and you're sad. Let's evaluate this." This is just so we can have an understanding of how you're feeling, because, like you said, they may think it's the baby blues, and I'm just sad because I just had a baby and I'm stressed out. But it's just something hormonal and chemical that happens, up until the first year. People think, oh, it's like within 6 months, but it could happen up to a year. So our role is to sit there. I'm sorry, there's a little background noise because the So our role is to help screen them, ask them honest questions. We do it like twice with them, maybe within the first 3 months. And then again, we do the screening and we ask them real honest questions about how they feel about themselves. I knew, for example, that I was going through postpartum depression because I would be crying uncontrollably. And there would be times where I would cry and I would feel overwhelmed, and there was times where I wanted a babies for so long and I finally have this baby, but now I feel like I don't want to have this baby with me, and I would like call his dad and say, "Hey, can you come pick him up?" Not because I wanted to harm the baby, but because I was just like, I need a break. So I know what I did was I called the hotline, to get the support, because I knew like, okay, there's something going on with me. But some moms don't recognize that. So our job is to like help them recognize and understand that it's okay if you have these feelings. How can we support you? So we'll connect them to support groups within the partnership. We have many support groups that we could connect them to, where they could talk to other moms about what they're feeling, or they'll connect them and do individual counseling. Like there's a lot of resources, there's hotlines out there that can help support mom and make her feel like she's not alone, because this happens more often than we know. You're on mute.
Thank you for that response. You mentioned there's things that, the individual won't recognize. As we talk about this, what are some of the other things, and let me just, preface this by saying we know that doulas are not medical folks, but there are certain things and so I'd like you to talk about how, um, you can assess if something else is going on, and then how do you respond to that client's need?
Yeah, so although we do like the Edinburgh screening, let's face it, sometimes people are not honest because they think they're going to get in trouble or they're going to be judged. And we're not here to judge anyone. We're here to support and help mom. So sometimes we'll know, like, okay, they scored a good score, or what is considered a good score on that screening. But then you observe mom and you observe, maybe she's not bathing, or maybe she's not eating, or maybe she's not caring to hold baby, or the baby's crying and they're leaving baby cry. Like we just go, and during the visits we observe to make sure everything's okay. When we're not visiting them, we still provide emotional support and we talk to them throughout the week. We do wellness checks with mom. So we observe those kind of things that are like, okay, mom is kind of sad and depressed and she's not taking care of herself, because it doesn't always have to be directly like suicidal thoughts or I'm going to harm baby, I'm going to harm myself. It could be other things like not bathing, not eating. So us observing that will, because we are not clinical, we would recommend them. Within the partnership, we have people on staff that also help with the screenings and talk to them and connect them with the right groups, with the support groups and groups that they need so that they can feel heard and they can know that, what they're going through is not something abnormal. Like, people go through this, we just don't talk about it and feel shame for going through this. So we're here to support them by connecting them with the right agencies.
And that's wonderful. I know one of the other things, there are a few things that may come up during this postpartum period, such as preeclampsia. We know that postpartum preeclampsia happens. And so, you know, how how do you make your client aware of certain things to look out for when it comes to elevated blood pressure and perhaps going into what we would call eclampsia?
Yeah, so it's very important that mom also takes herself to the doctor right after giving birth because we know we'll take the baby to get the checkup, well visit, and they get their shots when they're supposed to. But it's just as important for mom to go to those visits because we're not clinical, the doctor will be able to assess like, okay, when they monitor their blood pressure, okay, your blood pressure is really high. They get to see those medical side of things with us, like we could recommend mom if she knows that she has pressure to take her own blood pressure at home. And if she realizes that her blood pressure is too high, she should seek her doctor and talk to her physician. Or anytime mom feels anything's wrong after birth, by talking to mom and being there is how we sometimes can assess that, oh, she's been talking about this bleeding that won't stop, or she's been talking about elevated high blood pressure or speeding heartbeat. And it's like, yes, I'm not a doctor, but I have enough training to know that this is not normal. You should definitely speak to your physician and make an appointment to go see someone before it becomes something, because it's better safe than sorry. It's better that you go to the doctor and it be nothing than it turns out to be something.
Thank you, Vanessa. I'm reminded of a personal story. I have a niece who recently had a baby, and as I was talking to my brother and sister-in-law, what they mentioned to me that she was feeling a little dizzy. And they said, "Oh, we think it's because she's a little tired." And I knew that she had elevated blood pressure at one point in time. So I said, "No, my recommendation, take her right back to the hospital." And she was readmitted. So sometimes, and what she told her mom and dad was, "Well, you know, um, I've been up with the baby. So yeah, I felt like I was just tired and dizzy." And so those are some of the things that you look out for, right, when you're speaking to the clients.
Yeah, severe headaches, if they see that their vision are blurred, if they're vomiting, there's certain things that is like, don't ignore those signs because we know being tired is a known fact that everyone's gonna be tired. We're all gonna be tired, but it's looking out for those other things. Are you feeling pain? Do you feel swollenness? Do you feel like you have vision problems? Swollenness in your feet, in your hands. So we do look out for those things when we visit mom. And like I said, when we're not visiting mom, we still talk to them and ask them, how are you feeling? Physically and emotionally, so we also listen out to them, to what's going on with them, because of course changes happen. That first visit could be perfect and everything's fine, but in a couple weeks, we try to visit them twice a month, but in a couple weeks you don't know what can happen. So having those conversations, those honest conversation, and building that relationship with them where they could open up with you and be able to tell you those things is very important, so that way we can recommend them who they should go to, and get seen as soon as possible.
One of the things that you mentioned in terms of support, you talked about nutrition. Can you tell me why nutrition is so important? And, what are some of the things that newly postpartum women, or individuals need to have for nourishment?
Definitely water. Even when you're not pregnant or have a baby, like water is like the number one thing that everyone should take, because if you plan on, let's say, breastfeeding, which we also provide lactation support, but if you're gonna provide breastfeeding, you should be, as mom, intaking as much water as you can throughout the day. Um, there's certain vitamins you should be taking for nutrition value. You need to take, like, let's say your iron, because it helps with your blood cells, your vitamin A, which helps with vision, your vitamin C's, which help with the healing process. So there's a lot of things that we can do. Um, whether how you take prenatal vitamins, you know, up until you give birth, there's still vitamins that we need to take as well, after we give birth, and making sure we don't forget to eat. We worry about baby and baby getting fed every 2 hours, or when they're hungry, and it's like we ignore ourselves. But in order for us to recover quickly, we need to be eating the right foods, because the right foods will help with the healing process. It will help with promoting milk production. It will help with their skin. It will help with baby health. It will help with overall their health as well. So those are some of the things, as well as vitamin B, vitamin D for their bones, folate. There's a lot of things that we can discuss with mom and inform her. Like, these are some of the things that you should be eating, and not the fast food that you can pick up on the street, because you're not getting any nutrition from that. I know it's easier, when you're driving from a doctor's appointment, to say, oh, I'm going to go to McDonald's, but how are you giving yourself nutrition to be able to be healthy, recover quickly, and also be able to give the nutrients to the baby if you are breastfeeding? And you have to be healthy for your baby and healthy for yourself.
Yeah, and I know there's some things like different soups and stews and things that can be, made in advance. And, one of the things that I remember most was having, my family members, because they were close to, bring some foods over, so maybe those are some of the things, moms could think about, because again, there's
Yes.
certain foods that are important. Yes, we can talk about vitamins and supplements, but I know that there are
Yeah.
certain foods. And I know that. So do you
Mhm.
want to talk a little bit about, some of those foods that are really good for the postpartum period?
Yes, and it's funny that you mentioned soup, because my son's grandmother, like I mentioned, my family's out of state, but his grandma from his father's side, she brought me so much soup. And she's like, here, just keep heating up this soup. And all I did was eat soup and soup and soup. But there's things you could eat, like you could eat avocado, you could eat broccoli, you could eat nuts. Nuts could be like a nice snack you can have throughout the day, whether it's peanuts, walnuts. You could eat yogurt, you could eat cheese. You also have to have some protein, so you can eat like steak and chicken. Make sure you get your vegetables in, your fruits in, like strawberries, pineapples, apples, those kind of things. You could eat rice, but quinoa is even healthier. So eating your greens, your spinach, your celery, and your fruits are some things that you can, you know, doesn't take a long time, let's say, to cook, because I know sometimes we feel like we're pressed for time, because it's like you're taking care of a baby. I can't even squeeze in a shower. How do I have time for this? But if you go to, let's say, to a supermarket that sells the veggies and the fruit for an affordable price, then you can cut up those, strawberries, those kiwis, and have it already there, so that you can just go in the refrigerator and grab that quick snack. Even avocado, you can cut it in half and eat your avocado pretty quickly. And then the other foods that are healthy, like veggies, you can boil the carrots or the broccoli, or pre-make the quinoa and then just pair it with something. So I think meal planning is important. And you mentioned, like, maybe asking a friend. Like, sometimes friends and family think like coming over just to hold the baby is like support, but it's like, okay, on your visit, can you bring me a meal? Because I may be too tired to cook something. So you just tell them, like, you know what? I watched this Facebook Live, or I did my research online, or my doula told me that these are the healthy foods. So when you come, don't bring me Popeyes. Can you bring me a little something healthy for me to eat when you do come? And then you can have the baby while I eat. It's so important. Like, don't be afraid to encourage your family and friends to bring something with them when they come on the visit, not just to come over to hold the baby, but it's like, okay, when you come and see me next week, can you bring me a plate? Can you bring me some vegetables, a quinoa, and chicken or something? I think it's so important to be able to voice that and say, this is not how you're gonna help me. Holding my baby, I could do that all day. This is how you can help me.
Okay, and you did mention showers. So when we think about a doula and you go to the house and mom really just needs 10 or 15 minutes to, take that shower, how would you support in that instance?
So we love holding babies and being there with baby. So when we do go on the home visits, our home visits with mom are about an hour long. During that time, we would tell mom, like, hey, mom, if you want to go take a shower or take a little nap, we're here, to support you in that way. Mom can't leave the house and go like food shopping and go do laundry. As long as she's in the house, we can support her in that way. We could hold baby, we can watch the baby. If she did have laundry or dishes, we can also help support her in that way. It's like having an extra support person to be there to serve them in whatever it is that they need. Because I remember, they say, oh, sleep when the baby sleep, but most of the time we don't sleep when the baby sleep because we're doing laundry and we're doing the dishes, and now I gotta cook. So having that doula support there, okay, you know what? I can actually sleep now that the baby's asleep because those dishes that I have or that clothes I have to fold, the doula says she'll take care of it, while I rest for 30 minutes and get this shower in. So we're there to support them in that way as well.
Oh, I think that's fantastic. Every little bit helps, to really have, that additional support. The other thing you spoke about is lactation support. We know that. So just can you just talk a little bit about what is within your scope of practice and when would you make a referral to, let's say, an international board certified lactation consultant, which is an IBCLC?
Yeah. So at this time, we're in training for our lactation. So we could support mom in the knowledge that we know and learn, on how to maybe like latch or, produce and store milk. Like we could teach mom the educational information on, how to properly store the milk, the storage bags that they can use, how to freeze it, how long it should be in the refrigerator, also, maybe introducing positions like the education on positions that the baby should be in there. But for example, if there's issues with engorgement or mom's not producing enough milk or a lot of milk, then it's like a time where we'll say, well, we need to refer you to, a lactation consultant that maybe can come over, or you could go to the office and they teach you the proper ways to latch, reduce the engorgement, find out why maybe your breasts are hurting or maybe why you're not producing enough milk. They will have that education to train you in that way. But at least we could educate them in the positions and storage of milk and safe milk.
Yeah, so you can do like the rudimentary, the foundational things, but anything medical, as you mentioned, like engorgement or just something that just is beyond your scope, you would definitely make a referral. So, you did talk about referrals that you make, and I know there are a lot of in agency referrals that you make. Do you make any referrals to outside agencies?
Yeah, so another thing that we do is provide linkage and referrals to these families because although we may be there to support mommy and baby, sometimes there's other concerns that come up, like housing, food security. So we will refer them to outside agencies because we have so many partner agencies that we partner with and work with. If mom expresses that she's short on diapers and wipes, we might say, go to this agency or go to this diaper bank for those kind of resources. Oh, you don't have food? Well, I know an agency that can help you apply for food stamps. In the meantime, here's a list of pantries you can go to while you wait for approval, because we know the application could take a while. And while you wait for that, here's a list. So we do have lists of resources for diapers and food, and we'll connect them with the proper agencies to connect them with whatever else they're going through. Because how can mom be happy and stress free if she's like, I'm caring for a baby, but I also don't have food, to eat nutritious. So we recommend them and we refer them to those agencies. And it's not like they're on their own. We want them to advocate for themselves and call these agencies. But if they're having a hard time reaching someone, we will help them call and say, well, I have this contact. Here's this contact. How about you call this person and get connected?
Thank you so much, Vanessa. When I think of, all the things that we've discussed, and I guess the one of the last things is you did talk about mom, well baby visits. How about mom with that postpartum visit? Do you speak to them about, the importance of that? The
Yeah, so we make sorry, we make sure that mom also, especially at our first visit, it depends on how far along we got mom, because we could start working with mom when they're 35 weeks and on. So we asked them, did you go to your wellness check so they could check your pressure and everything else? And sometimes we get the response, oh no, not yet. And we're like, why not? It's so important to make sure you're not bleeding anymore or feeling abnormal pain or your high blood pressure is, your blood pressure is not high. So we do, remind moms to go to those visits because they're very important. Because we're not clinical, there's certain things we can't see. There's things that could be going on with you that's not visible to our eyes, but a professional like their doctor can say, okay, let's monitor this because your blood pressure is high, or let's see what's going on with these issues. So it's very for us, it's important to remind them about those appointments. So when we talk to them and say, when's your next visit? And we follow up with them, like, did you go to that visit? And they say, oh no, I didn't get to because like, okay, let's call and make another appointment then, and this time you're gonna go to that visit, right? So we remind them too if they don't go to that visit, and we follow up with them to making sure that they are going to all their visits as well.
Okay, so Vanessa, we know that services for postpartum doulas are being provided in Patterson, Elizabeth, Newark, and Plainfield. How would they contact you?
Yes, so we have Region 1 that covers Patterson, and then we have Region 2, so they can contact us via email, via phone number. We're working on our website to have a direct line where they can contact us, but also on our website, there is a doula email that they can go to. My email personally is vvalez@pmch.org, and I am one of the bilingual doulas there. So if someone speaks Spanish, they could come to me as well as English. And then we have 3 other women on our team. Shanice and I do Patterson, and Diana and Tonique do the other regions you mentioned, Elizabeth and Newark. Um, but I believe maybe in the chat we could probably put our email and contact information, and they could go to our website as well to get that information.
Okay,
So
that's just great. And just to sum it up, because we're getting ready to close out, if there's one piece that you want people to remember about this particular, about having a postpartum doula, what would that be? Just one sentence. Why do you think it's important?
for advocacy and support. A lot of people don't feel like they have the support that they need, and this program is actually free. They don't have to worry about like how they're gonna afford like a support person like this. So I would say we're here to support mom in all her needs and advocate for her.
Okay. So Vanessa, again, I want to thank you for your input. I want to thank you for the work that you do within the community. And again, for all of you who are listening, we certainly want to thank you for joining us. And if you have any questions, please feel free to reach out to the partnership. Our website is www.pmch.org. Again, we hope to have an additional topic on Facebook Live. But again, thank you for joining us and have a wonderful day and a great weekend. Bye.
Thank you. Bye.